UnitedHealth's OptumRx, along with Cigna's Express Scripts and CVS Caremark RX, were able to collectively pocket $7.3 billion in added revenue. OptumRx, which is one of the pharmacy benefit managers mentioned in this report, that were scamming cancer patients by overcharging by 1,000%.
Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio,
Tumwa, Iowa.
Please support the only independent outlet on the ground covering what the corporate media covers up.
Hey, it's Jordan with Status Coup. A month and a half after UnitedHealthcare CEO Brian Thompson was murdered, allegedly by Luigi Mangione, the health insurance company is celebrating today as it revealed its 2024 profits and revenue, a record level of revenue the company earned, and a pretty healthy level of profits. At the same time, a new report is out showing that that record revenue, that $14 billion in profits they made in 2024, in large part came from scamming cancer patients and overcharging them for drugs by 1,000%. Is there a Department of Justice in America? Do they prosecute criminals anymore? Let me give you the details first of UnitedHealthcare's performance. By the way, as we speak, as I'm recording this, my cameraman is on Wall Street. We're covering a protest outside of Wall Street of UnitedHealthcare and the predatory for-profit health insurance industry. So we'll have footage from that probably later today. Please support our on-the-ground reporting for as low as $5 a month. StatusCoup.com/join. Okay, so 2024, the owner of UnitedHealthcare reported record full-year revenue, but lower profits for 2024, just weeks after the brazen killing of a top executive inflamed the national ire against insurance companies. Let's give you the numbers here. Annual net earnings, that's profit, totaled $14.4 billion in 2024, down 35.6% from 2023 as it grappled with the aftermath of a cyber attack. So that might sound like, well, Jordan, they didn't do as well in 2024. Well, there was a major hack, cyber hack in 2024 of UnitedHealth and some of its subsidiaries, which delayed a lot of their business. So that's why the $14 billion in profit is considered down. It actually would have been more than that if not for that cyber hack. But if you ask me, $14 billion, pretty good. Pretty good. So $14 billion in profit made in 2024, largely off of fraudulent practices. Their profits are still large enough to rank among America's 25 most profitable companies. In the fourth quarter, so that's October, November, December of 2024, revenue increased almost 7% from a year earlier to $100.8 billion, while profit rose to $5.5 billion. So this company is making over $14 billion a year in profit, and it would have been more if not for that cyber hack. And as we've reported extensively since the murder of Brian Thompson, this revenue and profit not exactly being made by ethical practices. Let's read what UnitedHealth Group CEO Andrew Whitty said. You know, the CEO who, after the killing of Brian Thompson, said they are the guardians of protecting people against unsafe and unnecessary care. Well, the Guardian over here said, quote, the people of UnitedHealth Group remain focused on making high quality, affordable health care more available to more people while making the health system easier to navigate for patients and providers, positioning us well for growth in 2025. La, la, la. All right. Well, on the same day, same time this is coming out, a new report after the Federal Trade Commission commissioned a study found that UnitedHealth, the employer of slain exec Brian Thompson, was found to have overcharged some cancer patients for drugs by over 1,000%. OptumRx, the group's pharmacy benefit manager, which we've reported on, along with its two main peers, Express Scripts and CVS Caremark, have pocketed an extra $7.3 billion over cost thanks to price gouging, according to the findings of a report by the FTC. Let me read further United Health Group is charging patients a markup for key life-saving drugs that could easily exceed their cost by a factor of 10 or more, according to findings from the FTC, Federal Trade Commission. The report, which levels the same allegations at CVS and Cigna, is the latest indictment of America's broken healthcare system and comes on the heels of last month's shocking murder of United Healthcare CEO Brian Thompson. As I've said, it's actually not broken. That's just media spin. It's working exactly as intended, as a well-oiled machine. And the government and the politicians who have been purchased by United Healthcare are helping them do this and scam and kill vulnerable people. According to the FTC report, United Health's OptumRx, along with Cigna's Express Scripts and CVS Caremark RX, were able to collectively pocket $7.3 billion in added revenue above costs during the 5-year period of the study through 2022. The big three pharmacy benefit managers marked up numerous specialty generic drugs dispensed at their affiliated pharmacies by thousands of percent and many others by hundreds of percent, the report found. 1,000% increase in the price of a drug that costs $10 wholesale would result in a retail price of $110. The markup rate applied to 22% of the specialty therapies examined, including imitatib, a generic used to treat leukemia, or non-oncological tadalafil for pulmonary hypertension. Others, such as lamivudine, needed by HIV-positive patients, were nearly quadruple the price of their acquisition cost. Apologies, I'm probably mispronouncing most of those drugs. What's amazing about this, and of course, United Healthcare disputes this, says that these numbers were cherry-picked, blah, blah, blah. The findings leveled at the three big pharmacy benefit managers stem from a report carried out under the leadership of outgoing FTC Chair Lina Khan. She has been a frequent target of criticism due to her robust approach to investigate monopolies and waging battle with big tech, earning her the ire of major figures in Silicon Valley on both sides of the political divide. So naturally, Lina Khan, who's actually going after corporate criminals like United Healthcare and corporate criminals like Facebook, by the way, that's why Mark Zuckerberg has been sucking up the Trump and changing all of Facebook's policies to cater to Trump. That's why Trump is getting rid of her, because she actually is going against corporate monopolies and corporate criminals. Sorry, MAGA, to tell you the truth about your boy Trump there. He's not exactly a friend of the working class. That's why he's getting rid of Lina Khan. But I want to zero in specifically on OptumRx, which is one of the pharmacy benefit managers mentioned in this report that were scamming cancer patients, again, scamming cancer patients of life-saving drugs by overcharging by 1,000%, in some cases even more than 1,000%. Well, OptumRx is part of why United Health, which owns OptumRx, Optum is a subsidiary of United Health, is part of why they had $14 billion in profits in 2024, is part of why they had a record level of revenue. Here is the details of their earnings report that came out today. Speaking of United Health, group revenues rose 6.4% to $108 billion, just inside analyst estimates. Optum, that would be OptumRx, revenues rose 9.4% from a year earlier to $65.1 billion. Optum, which United Health purchased in 2011, is the main driver of the group's overall earnings. It's the nation's largest physician employer with around 90,000 doctors under its wings. So Optum, which is a pharmacy benefit manager, translated a completely unnecessary middleman that makes it harder and harder for you to get the drugs you need, the medicine you need, and in many cases is making sure you cannot get the drugs you need or trying to push you off onto medication that is not as adequate or efficient as the drugs you need. Optum is one of the biggest drivers of United Health's profit and revenue. Well, if you've been paying attention, we did a report and an interview on Optum recently where we interviewed a father who lost his son. His son had Optum insurance He had gone and gotten Advair, a very well-known asthma medication. He paid about $35 for the Advair. He had it for years. It treated his asthma. Here's what happened when he showed up in 2024 to get his Advair. Again, he had Optum insurance. I'm speaking with Bill about his son, Cole, who tragically died after a severe asthma attack. So when he went to the pharmacy, he had been getting Advair, which is pretty common for asthma, for years without a problem. And they told him what?
Oh, well, when he had presented for his prescriptions, essentially, he was told it was like $5 for his albuterol inhaler. And unfortunately, his Advair Discus was no longer covered by his insurance. And if he wanted it, it had to be $539.19.
United Healthcare.
Yeah, correct. Yeah. Well, 45 minutes later, I get a phone call from him. And I could tell in his voice that he was under distress, if you want to say. He was having an asthma attack. Cole was without oxygen to his brain too much, and it damaged his brain. He could not function unless he might have been on a ventilator, and that was about the worst news we could ever have. He was never going to wake up. He did donate his organs. He didn't go the perfect way of donation, but he still helped 75 people with his organ donation, which is pretty nice and honorable, but it allowed my wife and I, prior to the donation, to be with him in his last final moments. And my wife, my son, and I were very close to the last second that he was alive. I had my head on his chest, holding his hand. To his very last breath.
That's the father of Cole, a 22-year-old who died last year because he showed up to a Walgreens to do his routine pickup of his Advair asthma medication, which potentially people watching right now take. It usually costs them $35. It now had gone up to over $500, and he could no longer afford it. He left. A couple days later, has an asthma attack, doesn't have the Advair. It turns into a severe asthma attack. He goes outside to go to the hospital. It's frigid winter weather, which aggravated the asthma more. Turns into cardiac arrest. A couple days later, dies in the hospital. 22 years old. Would not have died. This would not have even been hospitalized if he just had the medication he needed. Share your healthcare horror story in the comments. Now that father has made it his life mission to reform this predatory for-profit system that I'm not sure can be reformed unless we reform the larger predatory for-profit system behind me, the United Corporations of America. We don't even have a representative democracy anymore. We just have a multi-trillion-dollar corporate conglomerate masquerading as a representative government. And I got news for you. The Democrats are in on it. The Republicans are in on it. Biden's in on it. Trump's in on it. All of them are in on it. Neither one have your interests at heart. I want to play this clip. This is actually from a doctor from a couple years ago, but specifically calling out UnitedHealthcare. I found it pretty interesting. I don't think I've shown it to you before. Let me show you.
These companies are horrible, 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 vile, disgusting, immoral, shameful institutions. This is the problem with healthcare in this country.
All right, listen, I'm going to preface this by saying that this is going to be an R-rated post. There are going to be a lot of F-bombs in this post, and I apologize if I offend you, but my back is half broken, I'm cranky, I'm tired, and I'm very upset. So here we go. Again, I apologize in advance. So this is a message to United Healthcare and Optum, whatever the hell they do. I don't know what they exactly do, but they're affiliated with United in some way. United Healthcare, fuck you. That's right. Fuck you, United Healthcare. And the reason why I'm saying this is because United Healthcare and whatever the hell Optum is embody everything that is wrong with healthcare in the United States. They don't care about patients. They most certainly don't care about their providers. The only thing these vile institutions care about is their bottom line. Now, I'm going to give you an example. This is a personal example. In May, we're about, I guess 2 months-ish into the pandemic, I get a notice from my biller that says, hey, we got this letter from Optum, who is like a subsidiary of United, that says, you owe us $1.5 million. What? $1.5 million? What are you talking about? This has got to be some kind of mistake. Well, he said, well, it says here that there were some notes that were requested, and because those notes weren't sent in, all of the findings relating to those notes were extrapolated to every patient's chart seen over the last 7 years, and based on whatever investigation that they've done through their billing, that's what I owe them. I said, this makes no sense. All I fucking do all day long is send notes to UnitedHealth. I see a patient, and this is all doctors, and I don't know why other doctors are talking about this, because this is a pervasive issue. I see a patient who has United or Oxford or one of the United plans. They're treated, they're gone, done, treatment is done. I submit my charges to UnitedHealth. Invariably, almost every single patient who has United, a month later, I get a notice saying, we need to review the notes. So we send the notes in.
I'll put the full video link in the description, but you get the point. A dermatologist being charged insane amount of money from UnitedHealth, the same company overcharging sick cancer patients by 1,000%. It's truly unreal. Like I said, we will have footage from a protest on Wall Street outside the Wall Street trading floors on the same day that UnitedHealthcare has released their record revenue and over $14 billion in profits. Please support our on-the-ground reporting for as low as $5 a month, statuscoup.com/join. We will continue covering this predatory for-profit system and, frankly, companies that should be prosecuted. If we had a Department of Justice that actually goes against and goes after criminal corporations, criminal CEOs. But alas, the Wall Street bankers are still not in prison. The fossil fuel executives are still not in prison. And frankly, you're not going to see any of the healthcare executives in prison anytime soon unless we, the people, rise up. Non-violently, but something has to be done here. They did not make $14 billion in profits off of good ethical corporate practices. They made it off of scamming cancer patients, scamming the elderly, delaying care, making the lives of doctors hell, and killing Americans and delaying and shortening the lifespan of Americans.